What are your thoughts on membrane usage for ideal graft placement?
You know, things fall out of favor, things are in favor, and I think that with different techniques and philosophies that come and go, you still have to always go back to degrees of success. And if you look at what does a membrane do, okay, and whether or not you need it all the time. Can you get quote unquote success without a membrane? Yes, but what is success? You know, everybody's definition of success is different. I mean, you know, for some people, getting a 60 to 75% bone fill, that's success. And, you know, for other people, that's failure. So I think what we have to look at is, you know, again, stacking all the cards in your favor so that you get the most amount of success that's possible in a particular case. So what does a membrane do? So membrane does two things. Basically, it contains the graft in the space. It protects it from movement, protects it from the oral cavity, and it also prevents soft tissue from growing into the site. So what do I mean by that? So when you have healing, you've got obviously the soft tissue in the bone. So fibroblasts are faster than osteoblasts. So in a kind of an unprotected site, no membrane, the chances for fibroblasts to grow down and in are greater than if you have a membrane that is a physical barrier to the fibroblasts from growing into the site where the bone is healing. So that's number one. And then number two, obviously, is that it's containing the graft material. So the different kinds of resorbable materials and non-resorbable materials then come into question when you use one versus the other. If an area is going to be completely exposed, for sure it's better to use any membrane, whether it be resorbable or non-resorbable. The one that will protect and last the longest will be the non-resorbable membrane. If you're using a non-resorbable membrane, you go back at 4 weeks and remove that membrane. The other choice that people don't talk about a lot, but I really like, is using dermis. So the dermis graft material is actually skin allograft that you use as a membrane. And as opposed to dissolving and resorbing, the dermis actually gets infiltrated with cellular activity. So you do get a thicker and higher quality of keratinized tissue in that case. So a lot of times where I have a situation where the tissue is real thin and delicate all around there, I'll use the dermis so I get a nice thick keratinized tissue with healing. So again, you know, it has to become a personal decision. You know, if you want to, you know, again, put every little bit of the procedure, every little part of the procedure, you know, do it to the best and stack everything, all the cards in your favor, then it makes sense to use membranes.